Well, as we've heard, Trump has put the blame for high drug prices partly on Europe, perhaps even more than the pharmaceutical companies themselves. Here's what he said.
It was really the countries that forced Big Pharma to do things that, frankly, I'm not sure they really felt comfortable doing, but they've gotten away with it, these countries. European Union has been brutal.
So, Dr. I appreciate that you see there are some merits to this plan, but you're also concerned. Why?
Well, I mean, overall, Americans and lots of people living in countries all around the world indeed pay too much for healthcare. And part of this is the drug prices, but part of this is also healthcare costs, hospital admissions, tests, etc. But there are limited details at the moment on how this is going to be implemented. There's going to be lots of legal and administrative hurdles, and this will have an effect on the industry. Give a few examples. I mean, reference pricing has its problems if the US administration is going to refer to the lowest price across the world. This can lead to launch delays, avoidance of the pharmaceutical industry in investing in low income countries because manufacturers aim to protect high income market prices. Countries often have non comparable baskets of reference countries. So they have different GDPs, different health systems. So at the end, you have very little coordination or real understanding of how to refer to a price in another country itself. Typically, what happens is reference pricing also leads companies to stagger their filings for registration. They start with the highest paying countries and then they work your way down, and this won't change. So, what will happen is you end up seeing that companies will, as they aim to protect the high income markets, there will be launch delays and avoidance in a lot of low income markets. And this effect will actually lower the pace of progress in low and middle income countries, where we've already been seeing as part of our work in the Access to Medicine Index, that the pace of progress has already reduced quite significantly.